We're there.
Yes, sir. How you guys doing, man? Is it an A-OK night?
We're there, man. Let's get my thing up here. Get all set up. What up, dude? Happy
Not,
Monday.
nothing much, brother. Nothing much.
What another interesting day in paradise. Another
Yeah,
interesting day in paradise.
that's what they say. That's what they say, and that's what they do, and that's what
Uh,
everything's about, I guess.
well, yeah, we are live, Tom. We are live. You get up in the morning, you have a good breakfast, you drink your coffee, you go to work, you listen to the governor's press conference or his state of the state. He really doesn't say much. He doesn't say, there is no real plan. There's a lot of vision, which is good. You need vision, but with the vision at the state of the state, you should have a plan. There was no plan. He talked a lot about the expanding the broadband so we could save the brain drain here in Hawaii so our kids can, because you can work remotely. Well, that is true. That also allows people to move here and work remotely from here. So, it's a double edged sword. The bottom line is this, Charlie. Right now, with a pandemic that's going crazy, with a shortage of vaccines, with a messed up system, there should be a plan. There should be a plan about the unemployment, the poor funds, all of these assistance for our people. Not one mention of all of that. Everything's hunky dory. We're moving forward. They didn't talk about schools. They didn't talk about taxes. They didn't talk about no plan. It was a vision statement, which is fine when you're running for office. But at a state of the state is exactly what that is. He's there to let us know what the state of the state is and how we plan to move forward. So anyway, that went out of the way. It was uneventful, I guess, is the nicest way to put it. And then you watch the lieutenant governor's interview with the Honolulu Star Advertiser, and it is, again, as usual, hunky dory. Everything's great. It's wonderful. He's still focusing on working with the governor to open up travel, remove all testing requirements, even the preliminary, the 72-hour pre-testing if you had a second vaccine. I mean, that was the kind of the gist of it, talking about how we're wrapping up the vaccines and we're looking at vaccinating all these people. I don't know if he realizes that we watch the news too. And we read the papers and we understand there's a shortage and Maui and certain areas don't have vaccines. So it's just frustrating because we know, and then you read the comments as it's flowing on the Star Advertiser interview, and everybody is in agreement that you're heading down the wrong road, Lieutenant Governor. And then lo and behold, you get the article about the new variant that's now in Hawaii. And I just heard on the evening news, one case was travel related, one case was not. And then you find out that the Department of Health failed to report 60 deaths that were not counted in the reports. And 60 deaths, and it is what it is, right? Hey guys, yeah, we missed 60. That's 60 people. That's 60 human beings with families that are suffering. So I guess what I'm trying to say is that it was a shitty day for me. It was a shitty day because, you know, we've been saying this for a long time, Charlie. We've been saying this for a very long time about the inaccuracies, the incompetence, the level of distrust, the integrity lapsing. I mean, we've been talking about this for 11 months, and you would think by now. I got, one of my buddies on the post said I kind of went overboard. I guess that they did explain themselves about the miscounting. Well, no, they said what happened. They didn't say why, and they didn't say who was responsible. I don't care. 11 months later, guys, you don't have it down yet. You better stop thinking about doing anything else except getting your shit together. Getting your damn crap together. getting the trust back from the people before you even consider doing something else. Anyway, I'm done, Charles. Thank you.
Well, the two cases. One was came from a cluster in California, and listening to Dr. Kimball, I guess she's a new state epidemiologist. One is still being investigated, but this goes in line with my last post, and that is I've said from all along where basically I was mocked because they're saying like you don't know what you're talking about, sir, because it takes a certain type of investigator. Well, this is the kind of stuff I was worried about because they said that now it may be too late because the person, by the time the evidence came back from the state lab, the person had already done their isolation period and maybe they're no longer there. Okay, but what about the person that came in contact with that person? What about the person that came in contact with the person that came in contact with the person that was infected? What about the person who probably infected the person who finally reported the thing? You see, that's a lengthy investigation, but that's how investigations are done. Because I remember in the police department, they say that when you go to a scene, you take as much information as you can because once you leave the scene or you open the scene up, guess what happens? Whatever information you may have failed to get is gone. It's aloha. And that's where we're at right now because they can't go back and contact whoever the infected person came in contact with because that information is gone. It doesn't seem like, or find out if in fact, because, and what really caught me off guard tonight was the statement that the state is saying, we can't see this thing being that transmissible, blah, 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 blah. It's not highly transmissible. Yet, these last 2 days, from Fauci all the way down to all the states affected and their health officers or epidemiologists or virologists in those areas are saying why it's a concern. We're the only state that's saying, it's okay, no, nothing. I'm like, are we? This is like round two of who to believe, right? And so, all these people that don't want to follow the rules, you can't blame them. You really can't blame them because why? We got state people that's facilitating it because they're making up all this kind while the rest of the United States is concerned. We're not concerned. We have nothing to worry about. Well, when you put out a message like that, and then you get all these goofballs that say, I don't like wearing masks. No, go blame them because you're empowering them to think that way. That's why I remember what my slogan has always been. Something about the messaging. We gotta get the messaging right. And it comes and it
Charlie, when we early on, months and months and almost a year ago, we had the Senate COVID committee on here, Senator Mercado Kim and all of them, and we told them hire retired cops.
Right.
Hire retired cops.
Yeah.
Hire. No, yeah, we're going to out hire. And what? Oh, you need a medical degree. You need to have medical experience.
No. That's why I backed off because I don't like to be laughed at. But they basically laughed at me. So I said, instead of me getting mad, right? I said, okay, I get my big boy bebedies on. I'll chalk it up. You laughed at me, fine. But heaven forbid, heaven forbid something like this come back and bite you. And look, what happened today? Did something bite us, Mel? Was there something on the news that says the variants in Hawaii? And they don't know if it's been here for quite a while or if it's something new.
Yeah. No, it's been, Charlie, they were just doing the testing. They were doing that scientific exams on all of the cases to find, and they finally found it. They probably don't even know. You hit it on the head, Charlie, and I've been saying this forever. The lieutenant governor minimizes this pandemic to satisfy his lust for opening up the state. That's what he's doing, and it's dangerous. I've called this months ago. He is dangerous when he says those things because you're right. People look at that, and if you watch the interview today, We actually in really good shape, and we're not. You know, I get nothing against medical people with degrees, but when you're looking at contact tracing, you need investigators. You know, you would never ask cops or retired cops to go give shots for the vaccine. No, that's the people you use the medical trained people for. That's the specialty. But when you're trying to track down a virus or contacts, no, you bring in people that have the experience. Those are the cops, not medical personnel. Just because they got a damn degree? Come on, man. Come on. Wake the hell up, and you better do it soon, guys. Anyway, we got a fun show tonight.
Well, let me just preface this. Leading into tonight's show, the reason why we wanted to bring this individual on is because we know that a lot of people are affected because of this pandemic. A lot of people have lost their medical. Now, I want to make it perfectly known that I am going to ask the question tonight of our guests. The program we're going to talk about, because it's affordable medical care, especially for those who have lost their medical coverage. If this program that's being offered, if it's only for Oahu and not any of the other islands, we got to get that clear, because I can see there are a lot of people that's watching there from other islands, Kauai, Maui. I see a couple of big island people on tonight. So what we're talking about, and I am going to ask them, could this program be duplicated to go to the other islands? Because right now, many who have lost their medical and they're on Cobra. I just talked to one person today. Uncle, I stay Cobra, me and my wife and my 2 kids. I go, how much? They did no job. That's why the medical lost $1,700. 1,700.
So you guys all know Dr. T, Doctors of Waikiki, and we're going to bring him on right now.
Yep.
But yeah, you know, I don't know how far reaching the program is, but I know it's going extremely well on
Yep,
Oahu. I would love to help him expand that to Kauai and other islands. There he is. Look at that. Look, he's got the Hollywood background. He's got, man, I can see the ring lights. This guy is.
Wait, I'm coming.
You're there, buddy. You're there.
You're here. You're here.
It's
You're
my
right.
name. I can't be Casey Cam. Casey Cam is one of the providers that works for me.
Oh,
All right.
there you go. Tony T.
How's everything?
Good. Thank you so much for
What is that your name?
Casey Cam? Oh, it's Dr. Love. Wait, did you guys change it to Dr. Love? Oh, you guys are good. All right, no now.
Yeah, we gotta fix that. We gotta fix that because
I'll take Dr. Love.
well, we all know you as Dr. Love, but you know, because of the media that watches this, they may take a screenshot and put them up on the news tomorrow. And,
That's right.
so,
And then they'll say Dr. Love, and then we'll not know who it is actually. But
Dr. Tony Trpkovski, how have you been, my friend? It's been a while.
I've been good. I've been getting creative, trying to think of things I can do to help the community.
Yeah, and you know, just to let you know, Doctor, that before you came on, I wanted to make this, you know, so they understand, because we have a lot of viewers, not only on Kauai and Oahu, but across the state. So whatever we talk about, and we're going to be talking about what's behind you right there, Niu Health.
That's right, Niu Health.
And how it started and all of that. If this is not experienced on any of the other islands, let us know, okay? Because I don't want anybody to walk away thinking, oh, okay, yeah, well, yeah,
No,
let's do.
Actually, before you go there, Mel, it's available everywhere. The online portion is available all throughout the islands.
Okay.
Physical clinics are only available in Oahu, obviously, but I'm soon going to build on the outer islands and in Oahu more clinics. Right now we have 2, one in Alawana Shopping Center and one in Hawaii Kai, with plans to put one in Kapolei, Kaneohe, and North Shore.
Okay.
Then I'm going to put on the outer islands little clinics where people get physical care, but most of the care is online. And I'll explain everything.
Right
Okay.
on.
Right on. Good. Okay.
So before we get to Niu Health, how have you been, man? What's the temperature like in Waikiki right now?
Well, the temperature is interesting because we do see a lot of tourists now. well, not a lot, but we're seeing more tourists and we're seeing locals. And we're still doing a lot of testing and we're still dealing with COVID actively. I mean, it's not going away. It's probably not going to go away for another or get controlled for till next Christmas. But, and I saw that the new strain, they found it here in Oahu, but I wouldn't know if they, we were testing people with new strain or no strain when we get a positive. We don't know. They don't tell us. They keep all that in the dark.
But
Just like at the beginning, when they started.
Wouldn't you think that it would be to your benefit, especially if you're treating someone that you tested, that if it was a new strain, that they'll come back to you and says, hey, we've got a positive hit on B11, B117, right?
Right.
Okay.
It'd be nice to know. I mean, everybody in my office now is vaccinated and I'm vaccinated, but you never know. You don't know if the new strain is going to elude the vaccination or not, but hopefully, according to Fauci and other people who are talking about it, that even the current vaccine from Pfizer and Moderna are protective against even the newer variants that they're finding. Hopefully that will continue. And even if other variants come around, that they'll be protective against it. But you never know. But I think it'd be nice to know. I'm a scientist. I'd like to know. I wish the state would tell us. But maybe they will. Maybe if I have a patient that has this new variant, they'll tell us. But so far, I don't know.
Hey, Doc, I want to ask one question, and then we'll turn it over to you for Niu Health. But
sure, anything you guys want to ask.
That's burning in my mind and many others' minds. It's this, back to the travel policy again. There's talk that the state wants to possibly remove all testing and quarantine requirements for anyone that had a second COVID vaccine. What are your thoughts on that?
I think the vaccine part, if we're pretty sure and we're confident that the vaccine's working effectively, then that's not a bad thing. I mean, it'd make it a lot easier for a lot of people for traveling. I mean, there's a lot of countries now that are opening up their doors saying, if you show us you've had the 2 vaccines, you can come to our country. That's just going to start. That's not going to be anything new. But I think Hawaii is looking at, now they still could do testing and do the COVID vaccine. Maybe they'd have to not be as crazy as they are about where you have to get tested. If you get tested somewhere and you've had the vaccine and it's not a specific test that they're looking for, then maybe that might be the way. But I don't know, Mel. I think it's just going to keep on evolving. They're trying to make it fair for the patients. So like right now, here's the newest thing. If you've had COVID-19, right, and you want to come to Hawaii and you've had it and you're like, 2 weeks out from, quarantine and everything, you can come to Hawaii. You don't need to get tested, because if you get tested, it's going to be positive. It's going to still show that it's growing in your nose, but it's not growing in your nose. It's going to show it's going to be a false positive, because a PCR test is very sensitive. Even dead virus will show up in your nose. So the antigen test will be negative, but the PCR will be positive. So what they've done is they said, you know what, you can come to Hawaii, even if you've had it, you don't have to get tested again, which is not a bad idea. But this is what we're dealing with. It's going to be nonstop evolving. We don't know what's going to happen next.
I know that the CDC said that they're months out from determining whether or not people that's gotten the full cycle, the 2 shots, can actually contract or spread the virus. And that's not that information from what I read today. In fact, it's probably not going to be available for another 2 to 3 months.
Yeah.
I think that's the concern of everyone, is that shouldn't we wait for that information before we start letting people in untested?
Right. Yeah, I think there's going to be a time and place for that. I think it's going to take maybe, like we said, some studies and look at it and now analyze, are we really immune? Are we really unable to pass the virus after we've gotten the vaccine? I don't know. That's why I think they should slow down a little bit. We've got testing. We should do the testing. It's available. It makes everyone feel more secure. Now, people still slip through every now and then, but that's normal. There's no way of making 100% barrier to people coming unless we don't let anybody come in.
Well, let me ask you this before we move on to the real
Sure.
meat issue of why we have you on tonight.
You can ask me anything.
there's always been this mystique about when people get vaccinated, right?
Right.
We know that the vaccination will apply to the symptoms that you may get, where it minimizes it to a point that you're not going to be it's not a death sentence anymore, not like how it was before.
Right. Right.
Okay. So sometimes I almost feel like it's a false sense of security because you got vaccinated, and especially for those bozos that don't want to still wear masks and all that, they could be, the lethality of it all is they could actually be carrying it, right, and giving it to somebody else, even though they themselves are not gonna. They basically are a walking asymptomatic person. That's what happens.
Yeah, it's very possible. We don't know, Charlie. We don't know. That's the thing, is we don't know. I mean, I think what's going to happen is in between world we're in right now, where a very small percentage of people have gotten vaccinated. Yes, I think that's important. But let's say we got more and more people vaccinated, then we get this herd immunity, and then the virus is going to kind of slowly go away, hopefully. And then maybe we'll have outbreaks every now and then. We'll have maybe in the like the flu, we'll have an outbreak in the fall and the winter. Then we're good till all summer. I mean, for example, I still see the flu during the summer, but it's very rare, but it still happens. But same thing I think is going to happen with COVID. We're going to see little outbreaks and then it's going to go away. We'll see an outbreak, it'll go away, And I think they're going to keep on improving the vaccines. They're going to come up with different ways, hopefully, to give better immunity and longer immunity and deal with the variants. So I'm very hopeful. I'm a positive guy, so otherwise.
Admit you've always been a positive guy. The only thing that I would like to leave with this part is, I know they're looking at roughly maybe 75% to 80% to achieve herd immunity. And
yeah, it's a lot of people.
Yeah, and because there's this difficulty in producing more vaccine right now, they might say, okay, we reach 80%, we're just not going to make no more. So those 20% that do want to take it is, well, sorry, you're part of the 20% that falls out of the realm because we're going to achieve herd immunity and you're the sacrificial lamb. Bye-bye. That's what I'm worried about. That's the
part. I mean, I thought we wouldn't have that many problems, but look, we're already starting to see some vaccination problems. They're going to have problems getting enough vaccine.
Yeah.
Now, there are several companies working on the vaccine. So I think if we're lucky, we'll have, 5 to 10 different candidates all, working together to vaccinate the whole world. But it's a hard task to do. It usually is something that's almost impossible, but it can be done. But it's going to take a lot of time and effort and money. It's going to take a lot of time. I mean, to vaccinate our whole island, it'll probably take 2 years, the way things are going. There's no way it's going to happen very soon.
Right. Okay.
Well, I appreciate you being positive, and I am too. I look forward to the day that when you go into your doctor's office for your checkup and they say, did you get your flu vaccine? Did you get your COVID vaccine?
Yeah.
And it'll be readily available all throughout, the year. And I think
maybe I'll be ready. When you're ready, maybe I'll give you the COVID vaccine once we get it.
In fact, they just talked about it. They just talked about it today.
Yeah.
They just talked about it that if they can get these other companies online, they're looking at having the doctors dispense it.
Well, we've always dispensed the vaccines before. Why they took that away from us is really ridiculous. You think about it. They gave it to the hospitals and they gave it to Walgreens and CVS. Walgreens and CVS, I mean, they have no relationship with patients. All they are is a pharmacy, but now they're like a health institute. It's crazy.
I
right?
tell you, man.
Yep.
When we're all done, man, we're gonna write a book.
That's right.
Charlie and myself, we're gonna write a book, man.
Crazy COVID. Yeah, but out of bad things, sometimes good things emerge. Sometimes good things are born. And that's how I came up with this idea for Niu Health. Because
that's the segue. That's the segue, Doc.
That's the segue. I was really worried because there's so many people now that don't have insurance. There's so many people that have insurance, but it's bad insurance. There's so many people that struggle and they want safe and they want good care. And they want care because they need to have care. People have diabetes. People have high blood pressure. People have heart disease. And what they're going to do is they're going to say, well, I don't have any money now. I don't have insurance. I can't pay for my medicine. I'm just going to, scramble so I can survive to pay my rent and pay for food and what have you. But that's ridiculous. What's going to happen is all these people are going to suffer, 3, 4, 5 years from now, not taking care of themselves They're going to have all the complications related to these healthcare problems. I really don't think healthcare, there should not be a barrier whatsoever to getting care. It's just the problem is cost. So how do we come up with a way to make it cheaper so that everybody can get care? Well, I came up with a way. And so I looked at big companies like Google, Facebook, YouTube, even the cable TV companies, because they all have a different way of monetizing and how they make money, right? So what they do is, one way is the subscription model where people pay a fee monthly, kind of like Netflix and Hulu and all those. But then also they do a little bit of advertising, and that's what you get certain aspects of monetizing these businesses. So I said, how do I apply this to healthcare? So what I did was I created a platform that when you go in the platform, you see the doctor or the provider, and then before you see him, when you're in a waiting room, because when you go to a waiting room to see a doctor normally, right, you wait, right? Well, here you wait 5 minutes and you watch sponsored ads from local businesses. And that's how I pay for it. The subscription model pays a little bit, the advertising plays, and then we use some data analytics, and that's how we make money. So I'm able to offer care without insurance for less than $10 a month for 24/7 access, 365, both online and in physical care. And I'll explain it more as I go along. Can I share my screen and play a little video for you?
Unmute, Mel. Unmute.
Yeah. Oh, he missed it, man. He missed it. I said no.
Okay, wait, that means yes. Wait a second.
Go for it, man.
Let me see if I can make this thing work. That's always fun. Let me wait. I got to make this small.
Yeah, I actually had the video queued up, but I couldn't get it to run on my computer. I don't know why. I was gonna share it, but
Let me see if I can. Wait.
But I gotta, while you're doing that, I just want to say, man,
One
thank
second.
you.
I'm getting there.
What an innovative way.
And I'll do share screen.
A lot of people doing that now. I mean,
This.
buses across the country have advertising in the buses.
Can you guys see that?
Yeah.
Yep.
Okay. Let me make it big and start it. Here we go. Bam.
Yeah, it's just the sound. Yeah.
Can you hear it?
No, the sound's not coming across, but that's okay. We can see. We can see the
Well,
That's okay, Doc. Just let it.
all
let
right.
it-
I thought you guys hear it, but if you can't hear it. All right. You couldn't hear any of that?
No.
There was no sound.
All right. Well,
Yeah.
that's kind of like a explanatory video of what we do, but I'll explain it to you guys. I'm good at explaining things. All right.
Okay.
So normally, how do you see a doctor? You got to either call on the phone, make an appointment, or if you're lucky, you go to urgent care. But most of the time, you got to wait, right? And then you got to have your insurance card, or you got to have cash. If you're lucky or unlucky, you don't have a job, you might get state insurance, right? But a lot of people don't take the state insurance, so it makes it really difficult to get care. So I know of all these obstacles because I've been a doctor for now 30 years. I've been in Hawaii almost 20 years, and I'm very frustrated that there are people that just can't get access to care because they don't have money or they don't have insurance. So that's why I came up with this. So when you go online, you become a member. The member in our community, you become a Niu Health member. I called it Niu because Niu means coconut in Hawaiian. And coconuts were very important for the Polynesian culture to spread throughout the whole area. Without the coconut, they weren't able to do it because they used that for water, for food. They planted the coconut, they used that to make clothing and structures for living, right? It's the same thing. Niu is going to spread healthcare throughout the world and starting in Hawaii. This is only available for Hawaiian residents. And I wanted to make it so that nobody could say no to they don't have a reason or excuse not to get, things taken care of. And I'll explain a little bit more. So become a member. If you go month to month, it's $9.99, $9.99. Unlimited use, both online and physical care. Here in Oahu, you get physical care if you need it. If you want to sign up for a year, it's $7.99 a month. It comes under $100 for a whole year of medical care. And then let's say I see you online, you need a problem, you got some coughing or something else is wrong, and I can take care of it online. I can send your meds, let's say you have insurance, to the pharmacy, or let's say you don't have insurance and you need a little help and you need to get our prescriptions that we have that are low cost. I have these Amazon lockers in these physical buildings of mine that you can actually come in contactless and get the meds and then be on your way. So I wanted to bring a couple of things for cost for most of the meds. I wanted to give them low cost medications, low cost labs, low cost x-rays. So they have a way to get taken care of even though they don't have insurance. Most of my meds are less than $5. So cholesterol medicine, antibiotics, diabetic medicine, your test strips, all that stuff is inexpensive. I'm practically giving it away so it can help the people. Now, for the outer islands, I can do the mail order. I can send the meds to them. I have to just mark it up $1 to cover shipping and handling. So that's what I've come up with to help with the outer islands. So they need their metformin, or they need their gout medicine, or they need their what have you. All they do is, go through the system, through the portal, and they, talk to our provider. Then the provider will order it, and then we'll mail it to them. They'll get it in a few days. Now, let's say I can build some hubs in Kauai when I get there, right? Let's say I have one in Luhui. So I see you online and you need a little bit more help. You're a little bit more sick than I can take care of online. I say, okay, Charlie, I'm going to send you a consult to go to one of the hubs over there by the shopping center, and you'll go there by the mall, and I'm going to see you, and then you tell me what time you can make it. You say, I can come there at 8:00 p.m. Okay. And then I look at the schedule, and the computer tells me how many people I can fit in to that 8 p.m. time slot, so it's safe. So then I send you a QR code and a door code. The door code lets you open, and the QR code helps you get in through the door. And once you're in, then you can see the private provider at that fixed period of time. See, I don't want everybody coming at the same time. The doors are always closed. The only way you can get in is if you're a member and you have the code. And then once you're in, one of the nurses come and gets you, puts you in a room, they take care of you. And then whatever you need getting taken care of while you're in the room is closed at that time, that encounter, and you go on your way. Very easy. Same thing with, say you need a test. Say I see you and you look like you got COVID. You need to get a COVID test. Okay. I say, all right, Charlie, I want you to go to the hub at 9:00. The provider will be waiting for you, and they're going to get your COVID test. You come in, you come to the hub, you get the code, you get your test. They see you, and now some of the tests are more expensive than others, but they're the cheapest they can be. For example, I'm doing a COVID antigen test. It's $39. If you're a member, it's $39. I can do a PCR test for $129. Say you need to travel, I can do it for $129. These are the things I can do to help because I'm controlling the cost because I have a way to do that. One thing is people can go to the website and see it's www.niuhealth.com, and then they can look at some of the explanatory videos. They can see, what we're trying to do. They can sign up. You get 1 week free, when you sign up.
Okay.
Hey, Doc, I took the liberty of going to the website and pulling up the, your services chart.
Yeah.
Mind if I share that? You mind if I share that?
Yeah.
Okay.
Yeah. So you see that?
So that
So
maybe you want
very
to go over
easy.
that a little bit.
Yeah, I'll explain everything. So let's say you go to a traditional urgent care. What's your by me, there's no copay, right? If you go to a traditional urgent care, it could be $20, $50, $75 your copay, depending what services you get done. HIMSS enrollment is a mail delivery service for Men's Health, and they're about $30 for a consultation. If you go to your primary care doctor, it's about $15 to $35. You go to ER, it's way more than $100 your copay, right? By me, there's no copay. You're a member, you're $9.99, there's no copay. Rapid antigen tests, it's $39, okay, $40 with tax. You go to urgent care, it's over $100. Certain services don't provide these things. Again, antibiotics, I can give you antibiotics for $5 for a 10-day course, say amoxicillin or what have you. I also do men's health. I have the cheapest Viagra in town. It's $1 a pill. Everyone else charges $2 to $5 a pill. I have diabetes medication. I can do hair restoration, which is Propatia and some other things that I have to help with people so they don't lose your hair. We do wound repair. So let's say somebody has a laceration and they don't have insurance. If they go to an urgent care, it's $300 to $400. If they go to the ER, it could be $200, $300 to $3,000. If you're a member by me, it's $30. So if you got a cut, I can sew you up for $30. It's unheard of prices. We can do IVs for $50. So say you're dehydrated or you want to have an IV because you drank too much. It's $50 if you're a member. We're open 24/7. Most urgent cares, we're open, some urgent cares are open till midnight. Most of them close at 8. Only the ER and us are open 24/7. Labs are at discounted price. Nobody discounts the labs like I do. I'm trying to make it impossible for people to give themselves an excuse saying, I can't get healthcare. I can't get what I need from the aspect of getting care for cost, because it's not an issue here. It's really inexpensive. All the patients that I've signed up now, I think we've had over 300 people in the past few days become new clients. They love it because it's inexpensive. We're very accessible. And we're here for them 24/7.
Someone just inserted, do you have copay for vaccine if the insurance is copay?
No.
Number one.
If I get the vaccine and they're members,
yeah,
we're going to come up with probably a fee to do the vaccine, no copay. So I'm hoping to if we get the AstraZeneca, it's only a couple of bucks. It's like $2.50, under $3 a vaccine. So I would just charge them whatever it costs me for the vaccine and give it for free if they're a member. I don't charge for giving shots. We don't charge for drawing blood. So let's say somebody has HMSA insurance, they need to have a blood test. They can come in, we draw their blood if they're a member, and we send the labs to DLS, and DLS will bill the insurance. So we can see people with insurance or without insurance. It just depends on their situation. We can mold it to fit their needs. It's for everybody. I'm trying to change the way we do healthcare. Nobody's ever come up with a new concept like this. It's always been the same way. You pay me X amount of money to see you, or my insurance will pay me, or the state will pay. I tried to come up with a different way to do it. I wanted to see if we can come up with a way to be able to help everybody without being too expensive. What I say I've done is I've Robin Hooded it. I take the businesses that are in town that are successful, that advertise, and I say, advertise with me. Put your ads on my platform. So when you watch in that waiting room, you might see Surfco Toyota. You might see whatever there is that's a local business restaurant. And they're actually helping their customers because they're helping the customers that don't have good health care get care so that they continue to be a good customer. To me, it's an easy sell.
Now, let me, I guess, cross paths on this. What if someone's, like they're on the outer islands. Right now, you don't have hubs on the outer islands.
I know, but online we can, but go ahead.
But say they want to participate because, you got some pretty attractive prices with regards to medications.
Correct.
You're going to get meds. Okay.
Right.
And again, you're trying to help those who basically lost their medical because they've been out of work, things lapsed and all that.
Correct.
I didn't see a lot of asthmatic need inhalers. You have access to.
I have inhalers. My inhaler is, I'll tell you right now, $39. It cost me like $38. I put $1 on it for shipping and handling. $39 for the inhaler, albuterol. I can do nebulizer treatments really inexpensively. Majority of the meds are under $5. Now, what I want to do is I'm going to revamp the homepage and I'm going to put all the prices, everything up, so people exactly know what they're getting into. So I went, but let's see if they found cheaper somewhere, I'd be amazed.
One lady is asking because she does a lot of. She says, "How much are your ads to participate?" You talked about the ads and that to get on.
I could have her reach out to me. I'll give you my email later. Have her reach out to me. We have packages where they can actually advertise on the platform. Right now, we're putting our content on the platform, which are videos that I've created. There's one called Brudda the Brudda. It's about two local guys talking about health problems. You know, we have hypertension, gout, we have diabetes, and then there's episodes of a show that I've created also by myself called Ask the Doctor with Dr. T, and they actually ask. And we can have people sponsor those, or we can create advertising for them. But yeah, have her reach out to me. My email is Dr. T, DRT at niuhealth.com, DRT at niuhealth.com. And I'd be happy to answer all questions.
That's simple enough. That is
Yeah.
simple.
This is available for all the islands. So you say it's 11 o'clock at night, you don't feel good, you don't know what to do, or you have a question, you're worried about something, you have something you felt on your arm or your neck, or you just have a question about COVID. You know, my neighbor had COVID. Can I get the COVID? He lives 3 doors down. I don't know, whatever it is. For $10, I can answer those questions. We're available 24/7. I have people waiting to talk and to address all those problems they have.
This would actually work as an awesome supplemental insurance program for people that have insurance as well.
Right.
Just to get that 24/7 coverage,
Right.
that face-to-face opportunity,
Right.
and to get some discount medication. I think so. It doesn't necessarily have to be just for people without.
Correct. It's for everybody. That's what I try to say. It's for with insurance or no insurance, because
Yeah.
even if you have insurance that covers telehealth, you still got to pay copay. So whenever you do a telehealth with your primary care doctor, you got HMSA, you're still going to get a $10 to $15 copay. They're going to send you a bill, and you got to schedule it. You got to call the doctor, say, hey, I want to schedule online to see whatever it is, Dr. W. And then you'll schedule it. And then you got to wait. And then you got to see him. And it's not going to be the same day. Here you go on. We're waiting for you. It's the opposite. You know, it's kind of like
24/7.
Yeah, it's like a restaurant and the cooks are there and we're waiting. You come on in. We're here waiting and we'll see you and take care of it and move on. I've got 15 providers that work for me, doctors and nurse practitioners and clinical psychologists, because we provide also behavioral health. So when you need behavioral health, you schedule with our behavioral health specialist. He then puts you on the schedule and he sees you through our platform. You have to watch the ads, and then you have 45 minutes uninterrupted therapy session.
So one person had asked, so this insurance that you're offering, this
Well, it's an online, it's 24/7 online urgent care, in person and physical. For outer islands, it'll be just online. So
okay.
it's if you don't have any insurance, it's a really good deal. Now, does it cover everything? No. I mean, I can't cover hospitalizations and stuff like that. But later, maybe as we get bigger and we get more money and we can spread out to do different things related to healthcare. But right now, we need to just focus on immediate stuff. Like people have, coughs and colds and diabetes and high blood pressure and asthma and cellulitis and you name it, gout. They have so many problems that need to be addressed, and they're just foregoing it because they're afraid it's going to cost too much. I don't want people to have a reason. I'm calling it, there should be no barriers to healthcare. People should not have a reason why not to get taken care of.
Mm-hmm.
I'm trying to give back. My mission is to help everybody. We could charge even more, but I'm trying to make it low cost so that we can give everybody access to care. That's my mission.
Well, it's definitely worth more than $10 a month. No doubt about it.
Definitely worth more than $10 a month.
And I'm hoping that, it's an amazing idea. I mean, I like letting advertisers subsidize healthcare for people that don't have insurance. I think it's awesome. I think that's
Somebody's asking right now if they can buy stocks in your company.
Yeah. A year from now, we're going to go public. I don't know.
You can start by $10 a month.
Yeah, $10 a month, they can get stocks in the company. Come on, be a member and we'll get you stocks in the company. No, we got to change things. You got to really be different, right? Nothing's come out differently in the past, I don't know how many years in healthcare. It's the same thing. You got to have insurance, or you got to pay a lot of money, or somebody else pays for you. This helps not just here in Hawaii if it's successful. We can be successful in the whole world, even in socialized medical situations, because it'll decrease costs because somebody else pays. I mean, how is Facebook worth $50 billion? What do they make? Does Facebook make anything? No. You post pictures on there and they advertise to you. That's what they do. It's the same thing. So if we can make healthcare a different way to, monetize it, then all that extra money we make, we can put into the company. We can offer then hospitalization. We can offer all these different things. But you got to start somewhere. I'm starting with this, what I can do, right? And later, as we grow, we'll offer more and more services. Kind of like in the future, I could see it's becoming like a Kaiser, but a much lower, cheaper priced Kaiser. So that we offer all aspects of care, but at a much lower cost, maybe $50 a month, or $20 a month. But we need members. The more members we have, the better the value of our advertising, because it's all a numbers game. The more subscribers, the more people watch the ads, the more the value of the company, the more money we can generate revenue from advertising.
I got a question to ask regarding participation. Now, you might have some seniors, because I've got some seniors right now watching this, and they're very, very interested. But
Sure.
I just want to toss this out anyway, and I don't know the answer to it. But Medicaid, Medicare
Doesn't matter.
Doesn't matter.
Nope. It doesn't matter what insurance they have. It's good that they have insurance, so I can actually say they have a medication they want and their insurance covers it. They don't cost them anything. I'll just call the pharmacy or use what I call that, the internet prescribing, and I prescribe for them, and they pick it up at the Lahui Safeway or wherever it is. Doesn't matter. Especially if they have Quest or Medicare, it's the same thing. It just everybody who has insurance or doesn't have insurance can benefit from this, because I'm really giving them things that they don't normally get. Accessibility, because we're open 24/7, 365. 2, no copays, very low cost. $9.99 is cheaper than most people's copays, right? And then with one copay, you get access for 1 whole month.
Mm-hmm.
And then if you have a problem with cost of meds, so let's say I have some people have insurance, and those little strips that they get for the glucose meter,
Right.
They say their copay is $70. Okay, $70 for 50 strips. Well, I've got strips way less cheaper than that, and no insurance needed. They can get strips for under $15, 50 of them from us, and they don't have to have insurance. They're not running it. They're not having a copay or anything, that's like that. It just doesn't make any sense. Everybody's trying to make a buck, and they're trying to make a buck by marking things up. I'm trying to get things more real. I'm trying to bring the cost down. I'm trying to help a lot of people. It just the biggest problem I have is people don't believe it. They think it's like, wow, how can that be real? I go, I'm trying to explain to them how it can be real is because I'm doing a different way to get it paid for. We're not using insurance. We're charging you a lot. We're trying to get sponsors, like I'm saying, we're calling them Robin Hooding, and I'm taking people that have businesses that are successful, and they're helping because they're actually going to put advertising on the platform, and that helps pay for it. I become kind of like a TV channel, like a cable TV station,
Mm-hmm.
It's called a disruptive technology.
Yes, it's definitely disruptive.
It's exactly what it is, like Blockbuster Video,
Yeah.
Now you just go on Amazon, or you go on.
Right. Remember Netflix, like Netflix. Netflix came out before there was no Netflix. Nobody knew what was going on. Then Netflix came out. They were sending you videos home, and now that you don't even get any more videos, CDs, you gotta watch, through the platform. It's the same thing.
Yeah, it's amazing, and that will be the hardest thing, is to convince people that it can be done, because it sounds too good to be true, right?
Too good to be true.
That's
right.
kind of typical, but
no, it's typical.
At least you
because
come with a lot of credibility and integrity, so I think a lot of
Thank
people
you.
will take the chance. And I'm assuming it's a month-to-month deal, unless you buy the annual plan.
Yep, it's a month to month. If they buy the annual plan, they're good for the whole year. Like I said, for the whole year, it's less than $100, and they can use it whenever they want.
Someone is asking, is this a 340B program? I have no idea what a 340B program is.
No, it doesn't qualify. So if you have to have insurance because you're your employer, and you have to have insurance for your staff, no, it doesn't qualify, because I'm not a typical healthcare company like the rest of them.
Right.
That's why I'm so inexpensive. I could do a 340B, but I got to charge a lot more. And what's the point of that? I'm trying to make it inexpensive.
Okay,
I love it, man. I think I'm just going to sign up just so I can talk to you, man.
You got it.
Outside of the Mel and Charlie show,
That's right.
So someone just said again, it's DRT at Niu, NIU Health dot,
.com.
.com.
Yep, that's my email. Send me whatever questions they have. I can help answer them and
Yep.
be happy to point them in any direction they need to know more information.
So this goes out to Rosie Marsh. Again, it's DRT or Dr. T, DRT at niuhealth.com.
Yep, that's my email.
Amazing,
Wow.
man. Good stuff. Good
It's
stuff.
amazing.
You know, I
wanna-
love the innovation. First of all, I really appreciate your passion and your compassion for helping people. I mean, we've seen that from when you came to Kauai. We've
Thank
seen
you.
that for a long time. People that have been your patients have said it over and over and over. So I really appreciate
Thank you,
what
man.
you're doing, what you're trying to do. There is really no excuse. One of the things that I'm trying to think who that doctor that we had on the show talked about, and it sounds like I'm repeating myself all the time, but
Mm.
when you look at the tragedy of COVID,
Right.
and we utilize the number of cases and deaths. What we're not counting are the people that are dying because they're not getting adequate medical care because number one, they're afraid to go in because they don't want to get
Correct.
COVID. Number two, they don't think they can afford it.
Right.
And that is a travesty
Yeah.
if people are not going to the doctor because they don't have medical. And
Right. Horrible.
This is just an amazing.
Well, that's why I did it like this in a safe way. You can get online and get your care, but if you really need to be seen, I can do that too while you're in Oahu. I can get you come in and we can see you in a safe way because it's scheduled. It's not a long line in the waiting room. There's only preset amount of people can come per hour to the clinic. And so that way it's very, very, very safe, you know. And then the med lockers make it very safe to pick up the meds. The meds are in the locker, you pick them up and you go. You don't have to see anybody, you don't have to touch anybody, you just get your meds and you go. All in a very safe, simple way.
Unbelievable.
Yeah. Now
And
what's
if
really
you-
cool.
If you're on Kauai, if you happen to be on Kauai and you need to be seen, you need sutures or
Well, then I'd guide them to
like
the
that.
urgent care.
yeah, Charlie and I will be doing it.
Okay. We're gonna set up in your house or Charlie's house, where I call them hubs, a Niu healthcare hub. So you guys get ready, hone up your skills for sutures.
Well, I've done in the past week. I've done like 13, but I just have a hard time. You know, a lot of them is like I need to suture their fingers, and
Uh-huh.
just fingers just don't fit under the Singer sewing machine. It's
We just use super glue. We use super glue.
Yeah, super glue's good. All right, that's good.
it. So you're not gonna get the best care, but you know what I mean. Hey, you're gonna get it closed up.
Yes, I like super glue. But and then what else I've done to make it interesting is I've made, like I said, those videos. I have a media company that helps us create things that make people get them engaged with their health. Like the Bread of the Bretta show is really cool because we have a couple of guys, they're from Hawaii 5-0 before, and now they're one guy's a kind of a bigger heavyset guy, other guy's skinny guy, but the heavyset guy, he's more smart than the skinny guy. And they talk about, like I said, hypertension, or they talk about gout, or they talk about diabetes in a way that's really funny, but they educate everybody. So it's very interesting to watch. And those are about 4 minutes, you know. If you go on YouTube and you go to Niu Health, you can watch one of them. So if you go to YouTube and you put Niu Health in, you can watch one of them. And I don't know if you can get the sound up, but put on Bread of the Bretta.
Hold on.
They're very funny. I don't know if I can get the sound working, but I bet you
Yeah, I can get the sound. Niu Health, right?
Niu Health to YouTube, and then you'll see Bretta to Bretta.
Brother to brother.
That's the one. Click it. Let's watch it. It's really funny. Get
Okay,
ready
hold
to
on.
laugh and get
Hold on.
educated. Laugh and education at the same time, because humor is the best medicine.
well, while we're waiting for that to get started.
Here we go.
Here we go.
Your strum always healing for my uhane, bro. Music sounding good.
Nah, just playing a little bit, you know what I mean?
Another beautiful day, eh?
Yeah, beautiful over here.
Wow.
You know, the grass is green, the trees are green, everything all
The
green.
birds chirping.
Yeah,
Another beautiful day, my good
beautiful.
brother.
It reminds me of Uncle Jerry.
Uncle Jerry.
Hey, you know Uncle Jerry?
Which Uncle Jerry?
Uncle Jerry. The one down Florida.
Florida. I remember Uncle Tom.
No, not Uncle Tom, Uncle Jerry, the one he wrestled manatees all the time. He's the first Hawaiian manatee wrangler. Well, anyways.
Country boy Uncle Jerry.
Yes, yes.
Throw net Uncle Jerry?
Yeah, no, not throwing it, Uncle Jerry. Bamboo pole, Uncle Jerry.
Oh,
Anyway, he had a heart attack, boo.
no way. Uncle Jerry had a heart attack. No way. But is he okay?
Yeah, but he get hypertension.
He get hypertension.
Yes.
What is hypertension?
You know what hypertension is? When you get high blood pressure, and you gotta, go use less salt.
Bruh, you know we just did emu yesterday.
Oh.
You know, less salt you talking. The salt is very important to,
Better not say
to the
that crap.
people of Hawaii. Uncle Jerry, bruh, must be the loco moco with extra gravy,
Oh.
the mac salad with extra gravy,
Uh-huh.
the corned beef hash with extra gravy,
Oh,
the extra
corned beef hash.
gravy with extra gravy.
Oh, calm down, buddy.
And
Yeah.
the smoked meat.
Oh, the smoked meat. Gotta have the smoked meat.
Oh, wow.
Also, the high blood pressure can lead to a stroke.
Whoa, bro, one stroke.
Yeah.
What is a stroke?
What school you grad?
One that make you stand up, sing, sit down diploma.
Oh,
which one?
no, stroke is when you get a heart attack in your brain.
Whoa, my brother, I cannot even think.
Yeah, you won't think if you have a heart attack in your brain.
Bruh.
Why you're asking all kinds of questions that today?
Oh, I'm concerned about Uncle Jerry.
I know.
Which Uncle Jerry?
Oh, come on, your Uncle Jerry. The one who used to live in Arizona, Sedona, Arizona. And he played in the Peruvian flute music ensemble. That Uncle Jerry.
Uncle Jerry.
Yeah.
How do you even know that, you get high blood pressure and everything?
Uncle Jerry was, a little bit dizzy.
Yeah.
He's tired all the time. But, didn't think nothing of it.
Wow, my brother. That's crazy.
Yeah, right?
Maybe I should get checked.
Yeah. Hey, you know what? You can go down to the store.
Aye.
You get one of those, the blood pressure machines.
Oh, yeah. What,
know-
cost quarter?
Yeah. Oh, sometimes it costs quarter.
Oh, that's for the horse, eh? That's for the
Yeah,
horse.
that's the one. Yeah, that in the front, right in the front.
Yeah.
But if you put your, arm inside, you can check your blood pressure. You don't want to go.
Oh, squeeze the arm.
Yeah, squeeze the
side.
arm. I used to take them out all the time, but I broke one.
You broke one?
Because my arm big. Yeah,
I remember seeing that at Long's.
Yeah.
I remember seeing that.
And also, half Americans have high blood pressure and don't even know it.
Wow. Unreal. How can we cut all of this, the risk?
Well, you can exercise and,
Okay.
eat
Oh, wow.
less salt.
Less salt. I just told you, we did emu yesterday. We went bang them 3 times. 1, 2, 3 salt. What you trying to tell me? 1 salt?
Yes, one little salt, bro.
1 little salt.
If you have diabetes, that's even worse. Makes the kidneys, work less.
Oh, wow.
Huh?
My man. So, what is a good blood pressure to have?
Well, they say 120 over 80 or under is good.
120. What does that even mean, bro?
I have no idea, but it says on top of the machine. Apparently, it's a good kind.
That's a good thing to have right there. What about the inu, bro? What about the inu?
Oh, you cannot drink that much. Like 2 drinks, 3 times a week for the
Okay.
brothers.
Yeah?
And then 1 drink
Uh-huh.
3 times a week for the white.
Oh, we gotta take care of wahinis.
Gots to.
Wahinis gotta take care of us.
Mm-hmm.
Brother, this all sounds complicated to me.
I know.
But you know what doesn't sound complicated?
What's that?
Getting checked.
Yes.
I wouldn't want a heart attack in my heart or my brain.
That's why you giving me one heart attack, because you asked me all these damn questions.
Brother, we better go check.
Better go.
This kind of just goes through everything about what they're talking about, which is just something to help everyone connect a little bit and get a little bit educated about certain healthcare problems that are important in our community, like gout, hypertension, diabetes, heart disease, So it's educational and fun.
I love it, man. Good
Yeah.
stuff.
I
Good
like it. They're
stuff.
funny guys.
The 2 guys on Hawaii 5-0. Well, used to be.
The big guy was in Hawaii 5-0.
Okay, I
The
recognize
other guy
the
was
big
like a
guy. I don't
local
remember.
comedian. Yeah.
Do you show up in any of these videos?
Yeah. Put in the next one. You can put Ask the Doctor with Dr. T. Show a few clips of that. It's on YouTube right next to that one. Ask the Doctor. All these are, again, educate. People send us in questions and I answer them in a both interesting way and educational. This is how we can connect with the people, get them engaged so they learn about their health. Not very boring and
No,
stale.
you brought up something that's so important, and that is, to build up what you're trying to do.
Right.
The barrier you got to get through is people can't believe it's this.
Yeah, they can't believe.
Yeah.
Yeah.
So is there another direction that maybe we could get the word out? Because this is neat, because I see how people skip going to the doctor that they would normally do.
Sure.
And
Because
then you see the adverse effects because they've let it go on.
Yep. Their high blood pressure, they're not controlling. Their diabetes, they're not controlling. All that's going to lead to problems down the line. If people don't take care of themselves, I mean, we're going to have an uptick in cancers. We're going to have an uptick in a lot of problems because people have ignored their care for the past year because they were scared to go to the doctor. It was hard to go to the doctor. And now it's going to be even more difficult. They don't even have insurance. I mean, look at all the people that were involved in the tourist industry, from, you know, everybody that worked in the hotel, everyone works in a restaurant, everybody works in something related to tourism. 80% of them don't have work. 80% of them. And that's 80% of them probably don't have insurance either, or they have Quest Insurance, which is good, but they can't, it's a hard time seeing anybody. You know, there's only so many doctors and there's only so many people that take the Quest. But this is, there we go.
To your questions. Right, Uncle? He's quiet today. Melanie from South Dakota says,
Tourist.
I was stung by a jellyfish, so my friend peed on my leg. Does that really help, or was I peed on for nothing? No, don't pee on your leg. Now, there are different kinds of jellyfish. Certain jellyfish can cause other problems. Some people can have anaphylactic reaction to the jellyfish. So I think getting looked at by a medical professional would help. And try to get that memory out of your head, because that's going to be something you're not going to forget for a long time. Joe says, do expiration dates on medicine really matter? Well, do expiration dates really matter on food, like on milk, or on different products? Yeah, it really matters. You take a medication that's expired, it might not be as effective. So more or less, yes, expiration dates on medicine do really matter. Right, Uncle? Okay. I crashed my moped and have a lot of road rash. How can I heal faster? So, what he means by road rash, I'm assuming, is that when he crashed on the road, he scraped up all his skin, you know, probably his arms and his legs. So, I think it's important for you to make sure you clean your wound, soap and water, pat it dry. How can you make it heal faster? Well, yeah, keep it clean. And sometimes we'd recommend putting antibiotic ointment on it and some other things, but that's my advice. My coworker tested positive for COVID. Should I get tested? Definitely if you're having symptoms. Say you're having, like I said, a cough, a fever, sore throat, etc., which are signs of having COVID-19 infection. Yeah, you should get tested for sure. But irrelevant if you've had symptoms or not, you should get tested because of your exposure, especially if it's been more than 15 minutes. I hope and pray that you don't have it, because you never know what it can lead to. All right, next question. Got nailed in the head by my surfboard and blacked out. Should I get that checked out? Whenever you sustain a head injury, meaning you get hit in the head with some object, what happens is the brain kind of gets bruised. And if you bruise the brain hard enough, you're going to be messed up. And if you don't get it looked at and evaluated, you could even die. Because if you bruise the brain hard enough, it gets a real bruise and it can bleed. And if it bleeds enough, because it's an enclosed system, there's no place for the blood to go, next thing you know, you don't wake up in the morning. And just be more careful. Hopefully you're still awake and you get checked. But please.
And I do this, you know, I got like 5 episodes like this. So it's good though. It's humorous, it's educational. It gets people a little bit engaged with their health. It's entertaining. And now these videos like Brother the Brother and Ask the Doctor, those can be sponsored. So if you don't have a commercial and say you have a restaurant or you have a business, you say, I want to sponsor that video. Well, then we have a way to do that. You know, so they come in, they sponsor, and they help the community get educated and they help the community get healthcare.
Well, I can tell you from a scientific standpoint, when you get whacked in the head,
That's right.
you gonna feel something. Well, the best way, gang, is if you never had a wok before in your house and now you're gonna walk on your stove and you feel a lump on your head, you know where the wok came from.
Yeah.
And there's a lot of questions that we're not going to get to. So, hey, just email drt@niuhealth.com.
Yeah.
Go ahead and email Dr. T. You know, there's just a lot, and we're just not going to have enough time to answer them all. So if you got a question, just go ahead, email Dr. T, and I'm sure he'll answer them.
Excellent.
You know, I would like to also say, and this is part of the reason why I asked the doc coming on. especially for the island of Oahu,
Right,
many of the hotel workers, you still haven't gone back yet.
right.
I'm most definitely sure your medical insurance have lapsed. And a lot of you that live in a kind of multi-generational household, there's a lot of you. And now with COVID happening, you need some sense of protection. Now's the time. I mean, I'm not promoting this. I'm just, if it was me and I was stuck between a rock and a hard place, this would be an alternative. This would definitely be an alternative to
Yeah,
look at.
thank you. I agree, Charlie. I mean, this is what this is for. It's for people looking for a place to get help for their health care. I'm it. I'm going to give high quality, low cost care, 24/7 access. You need help, we're there. Nobody's offering this except the hospital and the emergency room. And it's not low cost. I'm low cost.
I will definitely be emailing you, my friend. Can you
Yeah.
please put the email? I will go ahead and I will post. Let me do that right now. Hang on, Doc, just because.
Write it down then people can see.
DRT, oops.
Yep, DRT. Yep,
at Niu
health.com.
Health.
Ask all the
Sorry.
questions they want. I'll send them in the right direction. I can help them get signed up. We can help them figure out how to get things, what they need, if they want to know prices, all that stuff.
Well, I mean, for those of you watching and for those of you that know someone that may benefit from this program, please get them to newhealth.com. And like I said, it's great as a supplement as well.
Yep.
And for those that, we want to help as many people as we can to get in front of the doctor. And Dr. T is allowing an opportunity now for anyone to have that access. So,
Yep.
awesome
If they're
stuff, man.
yep. If they're worried about COVID, I can answer their questions about COVID. If they're worried about COVID and they want to get tested, we can do testing. We'd be the least expensive option for getting tested here in Oahu. But even if they have questions, you don't have to always do something. Just sometimes giving them a peace of mind and reassuring them that they're going to be okay. That can be done online or on the phone. That's easy. Talking to a medical professional when you need one is sometimes kind of like a miracle. When you have a problem and they can give you the right answer, it's a blessing.
I do like to say one thing to our viewers as well. If anyone has any questions, just by him being on air and being an open book, that kind of tells you a lot. Because if there was a doctor that was kind of sneaky, and I know some of you, just by some of the way you phrase your question, sneaky doctors don't make themselves available and out in the open.
No,
they're not transparent like this guy is. So that kind of tells you something already.
yeah.
This
No,
guy's transparent, and that's all he's after.
I got nothing to hide.
There you go. That's all it's about. Okay,
Awesome.
Tony, thank you so
Thank
much,
you,
my
guys.
brother.
Thank you.
My. Mel?
Go ahead, Charlie.
Well, before we, I first asked him stay maybe half an hour, but I knew with all these questions popping up, it was going to be longer. And I just wanted to say on behalf of myself and everything that we stand for, Tony, you've been with us in the beginning. You came up here, you did the testing with us. I don't know how to thank you, and sharing your professional expertise in explaining, because even I had a hard time kind of conceptualizing how this would work, but I kind of got the four corners of the foundation of what you're trying to do, and I can see, it's a workable program. So again, ladies and gentlemen, it's all about the messaging, and the thing is, yes, sometimes it's too good to be true, but that's why he's on the air. That's why, and not only us. When he first broke, he was on Hawaii News Now.
Right.
On the syndicated news stations locally, and he showed it. So, but again, like what Mel and I said in the beginning, when you take on something as high quality as this, and you only focus maybe 5 minutes, you just give a little excerpt of it, it doesn't do justice. So that's why we wanted to give him as much time as we could. He agreed to a half an hour, and it's been almost an hour, and we're very, very grateful because it gives him time to explain about a complicated but worthwhile service that is provided. And I think this would benefit a lot who may have lost their medical coverage due to the lapsing of their medical coverage. So this is a real supplement that I believe will be greatly appreciated by those who really need it, especially for those of you that have high blood pressure, diabetes, okay, high cholesterol,
Infections, anything.
infection, those who are asthmatics, okay, like it's across the spectrum. So not to worry. If you didn't hear what you wanted to hear tonight, email him so he can get back to you and he can nail whatever he needs to
Yep.
nail with you, and so that he can put you at ease. But do it.
Yep. Yep.
Okay.
Thank you, guys.
Yeah,
I
Doc,
just
no?
thank
wanted, thank you so much for giving me the opportunity to get the word out. Like I said, my mission is to help a lot of people. If people need help in health, have them feel free to go to www.niuhealth.com or reach out to my email, drt@niuhealth.com, and I'll be answering all their questions. Thank you.
Awesome, Doc. Thank you very much. I mean, and going back to where you donated shields for the kids. I mean, you just been a community guy. We appreciate you so much.
Always have.
And we will be uploading this to YouTube as well. I'll send you the link and you can post it up and I don't know,
Put it
put them
somewhere.
up with your page or whatever.
That's right.
Appreciate you, Doc. Thank you so
Thank
much,
you, guys.
man.
I appreciate you guys. Keep up the good work. Thank you.
Aloha.
Aloha.
Well, Charlie, are you gonna sign up, Charlie? I gotta tell you, man. Charlie, I belong to a company called Legal Shield. We have the same model for legal consultations and so forth. I'll be doing a webinar on that in the next couple of weeks for our viewers. But I understand the model. It's an amazing concept, and it allows every person access to this medical service. And at $10 a month, it's a really, really good deal. And I really appreciate Dr. T. Thanks for getting him to come on tonight, Charlie. I think I think people gotta go check it out.
Well, again, I made that disclosure in the beginning because when I heard when I talked about it earlier, and he kind of gave me the concept of how everything was set up, I was like, whoa. And so I wanted to make sure that nobody got the wrong idea about the other islands, because like you said, the in-service or seeing a patient right now is only on Oahu until you can get the rest of the hub set up. But as far as medications and all of that, telehealth, it's statewide. So I'm happy.
He mentioned peace of mind. Yeah. A lot of people go to bed
Yeah.
at night so anxious and full of anxiety because of a symptom or something that they think is wrong with them. The fact that you can go online and speak to a doctor 24/7 to give you that comfort level. Hey, either you got to go to the ER or you're fine. They can do a quick diagnosis online and give you that peace of mind. It's priceless, man. It's priceless. So check it out. Check it out. Check it out. Check it out. Anything else, Charles?
No, I did want to say that we tried to get some individuals on, but next week, Wednesday, mark your calendars. We will have a team from KVMH, part of the HHSC or Hawaii Health Systems Corporation, professional nurses and doctors that's involved in the huge mega rollout of vaccines across Kauai in participation with HPH. There'll be Wilcox Hospital here, but also on Oahu as well as the other islands. And they'll be talking about the vaccinations, some of the nuances. We can go into more detail with them about what they know about the variants. That seems to be a hot button topic. But just getting the people ready, that those who are in the different categories, because right now we completed 1A, we're in 1B, and that's essential emergency workers, as well as 75 and over. Then the next comes the 1Cs, and that's a lot of your your essential stores that was asked to stay open, like your Home Depots and all of that. That's going to be the next rollout. And I believe the age rolls down to, I think it's 65 and over. Now, some people have written to us. I've gotten messages. Mel, you and I've talked about it, because you see the mainland news, and the mainland is already under the guidance. They're doing 65 and over, but we haven't hit here in Hawaii. It's because the programs are both guidance, both federally and state. for the state of Hawaii, it's still 75 over, 75 and over. So I know sometimes it's hard to digest, but people, like we said before, don't give up hope because we've got more vaccine coming. We've been assured. How much? That's the question. And last thing I like to say, Mel, you brought up a really good point. Why I get emotional about talking about this is because there's never been a time that Uncle Charlie has been on this show that have misled you folks, nor has Uncle Mel misled any of you folks. And we ain't gonna start now. We're not gonna mislead you in whatever information we have. I get hurt when I hear our administration or our government misleading a lot of people thinking that everything is a-okay. When I'm not trying to be skeptical, I'm trying to be positive, but I know what I see and I feel what other people feel. And when people lose their lives because of this virus, it hurts me deeply because I thought that sharing my brother's story would make a difference so nobody falls down that rabbit hole, okay? But it could become so counterproductive when we get people on the morning news or whatever saying that we're doing really good, when in fact we're not. Maybe we're not doing really bad, but we're not doing really good either. And I just wish they would tell the story straight like it is, like how we do it. You know, if our taste buds is at 5, I'm not gonna tell you it's at 10 because they're not gonna be lying to you. And I feel a lot of times we're getting lied to. All I'm saying is this: we're gonna try to equip you the best way we can. And that's why I say emotionally, I don't want you folks going down that rabbit hole too, because maybe one day if you follow so deeply into that belief that we're doing really good and something happened, maybe Uncle Charlie or Uncle Mel not gonna be there to help save you. And that's gonna really tear at my heart if that ever happens. So whatever we tell you, take it for what it's worth. But you still gotta do your research. I gotta do my research. Mel gotta do his research. But the thing is this, we will never forcefully and without due care lead you down a path that there is no point of retreat, because that's not fair to you and that's not fair to anybody who takes the time out to watch this show. We just want what's best, and we hope and pray that we are bringing the best to all of you. That's all I like to leave you with.
Thank you, Charlie. Thank you. I mean, powerful words from a powerful man, from a man that is nothing but aloha for all of you, and so do I. You know, we try to do this for that reason. You know, we try to do this so that we can provide our information is from when we go off tonight to come on tomorrow. It's building information, gathering information, relying a lot of information from many of you. Our information is as credible as it gets, and we just share that. And you know, I stopped posting the states numbers. Remember when I used to post the states numbers every day? And I remember months ago, and I said, you know, I cannot in good conscience post their numbers because I don't believe them. I don't think it's accurate. I do share the Star Advertisers report every day, but I will not report anything from the Department of Health. And it's a shame because it's been 11 months. And if they haven't gotten it together by now, then I'm afraid to say they're not. I try to be positive too, but I'm also a realist. And we have to take care of ourselves. We, us,
Yep.
you, me, all of us. And we hope this show can help keep us together as an ohana, share good information, and then it's up to you what you do with it. Yeah. So we love you guys more than you guys know.
Yep.
We'll be back tomorrow night. We got, don't forget, Wednesday, we got John DeFries from HTA. I sent out the invite to Tulsi Gabbard, former Congresswoman Tulsi Gabbard. We're hoping to get her on soon. I also, tomorrow, I will send out an invitation to the state auditor, Les Kondo, because now they're trying to get rid of him because he put out some factual audits on some incompetent state offices. Now they want to get rid of him. So I want to reach out to him, and hopefully we can get him on this week. So anyway, we try our best to fill this hour with good information. We hope you guys enjoy it. But we'll be here tomorrow night, 7 o'clock. Everyone, as usual, take care. God bless. Stay safe. We love you guys.
Love you.
Aloha.